After the age of 60, prediabetes does not slowly turn into diabetes, it accelerates. Medical data shows that more than half of adults over 60 with prediabetes develop full type 2 diabetes within just 3 to 5 years. Many do not even realize it until they suffer heart damage, kidney decline, nerve pain, or permanent vision loss. Prediabetes after 60 is not a warning, it is a countdown. Once diabetes develops, your risk of heart attack doubles, kidney failure triples, and memory decline speeds up rapidly. And the most dangerous part is this: most seniors feel absolutely nothing while the damage is happening. But there is one specific food that directly targets the root cause of prediabetes, and medical studies show it can improve blood sugar control in as little as 4 weeks. Before we continue, let's understand what this warning really means. The main problem here is prediabetes silently progressing into type 2 diabetes after 60. The solution is one specific food that helps stabilize blood sugar, reduce insulin resistance, and protect the pancreas, often within just 4 weeks when used correctly. This matters because after 60, diabetes does not just raise blood sugar, it quietly damages the heart, kidneys, nerves, eyesight, and even the brain, often long before symptoms appear. And once diabetes fully develops, reversal becomes far more difficult. If you are over 60 and your doctor has ever said your sugar is borderline, you're pre-diabetic, or you should just watch your diet, you need to listen carefully. Medical data shows that more than 50% of adults over 60 with pre-diabetes will develop full diabetes within just 3 to 5 years, often without warning. Once diabetes sets in, the risk of heart attack doubles, the risk of kidney failure triples, vision loss, nerve pain, and memory decline accelerate. And the most frightening part is this: most seniors feel nothing until permanent damage is already done. But today, I will show you one food that targets the root cause of prediabetes and has been shown in medical studies to improve blood sugar control in as little as 4 weeks. This information comes from decades of clinical experience in metabolic health and aging medicine. Doctors and researchers who have treated tens of thousands of patients over 60 consistently report that seniors who correct insulin resistance early can delay or completely avoid diabetes, often without adding more medications. Large clinical programs show that 60 to 70% of seniors with prediabetes improved or normalized blood sugar levels when targeted nutrition was used correctly. This is not theory, this is clinical reality. Here is why prediabetes gets worse after 60. As we age, 3 dangerous changes happen inside the body. First, muscle loss accelerates. Muscle is the largest glucose-absorbing tissue in the body. After 60, we lose 1 to 2% of muscle every year, making blood sugar harder to control. Second, insulin resistance increases. Cells stop responding properly to insulin, forcing the pancreas to work harder and harder. Third, low-grade inflammation quietly rises. This inflammation blocks insulin signaling and damages blood vessels. Together, these changes turn prediabetes into diabetes quickly, even if your diet has not changed much. Now let's clear up some dangerous mistakes seniors often make. The first mistake is thinking, "I'll just cut sugar." Sugar alone is not the real problem. Insulin resistance is. Studies show that low-sugar diets alone reduce diabetes progression by only 10 to 15% if insulin resistance remains untreated. Many seniors avoid sweets for years and still develop diabetes because muscle loss and inflammation were never addressed. The second mistake is skipping protein. Low protein intake accelerates muscle loss, which worsens glucose control. Research shows seniors with inadequate protein intake have 30 to 40% higher rates of diabetes progression. The third mistake is relying only on medication. Medication lowers numbers, but it does not repair metabolic damage. Without dietary correction, medication doses usually increase every few years. Now let's talk about the one food that changes everything. That food is lentils and other similar legumes. Lentils are not just healthy, they are metabolically protective, especially for seniors. They work through 3 powerful mechanisms. First, they slow carbohydrate absorption. Their fiber forms a gel in the gut, preventing sharp blood sugar spikes. Second, they improve insulin sensitivity. The magnesium and plant compounds in lentils help cells respond to insulin again. Third, they help preserve muscle. Lentils provide high-quality plant protein that supports muscle and glucose uptake. Clinical studies show that seniors who ate one serving of lentils daily experienced a 20 to 30% reduction in fasting blood sugar, improved insulin sensitivity within 4 weeks, and lower long-term blood sugar levels over 12 weeks. Compared to rice or bread, lentils cause up to 50% lower blood sugar spikes. Here is how to use lentils correctly. Eat one serving daily, about half a cup cooked. The best time is lunch or early dinner. Prepare them boiled or lightly spiced, not fried. Pair them with vegetables and healthy fats like olive oil. Avoid combining lentils with white rice or refined bread. Consistency matters more than quantity. If you are 60 or older or caring for someone who is, like this video, subscribe to the channel and comment your age or whether you've been told you are pre-diabetic. This channel is dedicated to protecting senior health, independence, and longevity using real medical science. Prediabetes is not a harmless label. It is a warning signal. But here is the hopeful truth. When addressed early, diabetes is not inevitable. By choosing the right foods now, you can protect your heart, preserve your eyesight, maintain independence, and reduce hospital visits and medication costs. Your health after 60 is not about luck. It is about informed action. Subscribe to this channel because the next video may protect your memory, your muscles, or your heart before damage begins.